Taking care of your health sometimes means having an endometrial biopsy. The procedure takes just a few minutes and can be done in the comfort of your healthcare provider's office. Most women can go back to their daily routine after the procedure. The endometrium is the lining of your uterus. During the procedure, a small tissue sample is taken from the inside of the uterus and sent to a lab for analysis. If problems are found, your healthcare provider will discuss treatment options with you. Endometrial biopsy can help find the cause of or diagnose certain problems like bleeding after menopause, heavy or irregular menstrual periods, bleeding associated with hormone therapy, prolonged bleeding, abnormal Pap test results, cancer, trouble getting pregnant, or fertility problems. Problems with endometrial biopsy are rare and include bleeding, infection, and damage to the uterine wall. A day or two before the procedure, you'll be asked to avoid using creams or other vaginal medicines and avoid douching. Certain tests may be taken to make sure you're not pregnant and do not have an infection. You may be asked to sign a consent form. During the biopsy, you will lie in an exam table just as you do for a Pap test. An instrument called a speculum is then inserted into the vagina to hold it open. An antiseptic solution will be applied to the cervix. The cervix may need to be dilated. It's normal to feel some cramping when the tube is inserted. Tell your healthcare provider if you have severe cramping or are very uncomfortable. Using mild suction, samples are taken from the uterine lining. This causes additional cramping. When completed, the tube and speculum are removed and the samples are sent to the lab for study. After the procedure, before getting dressed, you can rest as long as needed if you are feeling lightheaded or dizzy. For a few hours, you may feel some mild cramping that can usually be relieved with over-the-counter pain medicines. You may have some bleeding for a few days. Use pads instead of tampons. Do not douche or use any vaginal medicines unless your healthcare provider says it's okay. Ask your healthcare provider when it's okay to have sex again. It may take up to a week for the biopsy results to come back from the lab. You and your healthcare provider will discuss the results and if treatment or further testing is necessary. As you can see, the endometrial biopsy is a simple, quick, and effective procedure that gives your provider important information to help ensure you're getting the best care possible.